Welcome to the Antenatal Clinic for the University Hospital of the West Indies. Congratulations on your pregnancy, and it is our pleasure to go on this journey with you. After booking, you have routine visits right here in this antenatal clinic. The frequency of those visits depends on how far along you are in your pregnancy, or if you have any complications, such as an illness before, or if you're developing one in this pregnancy. One thing for sure, the closer you are to the due date, the more often you have to meet with us, because we have to look out for certain illnesses, such as hypertension in pregnancy. Each clinic visit is an opportunity for you to dialogue with your doctors and midwives. You can voice any concerns, and we can share as we determine how you and your baby are doing. Every visit, we check your blood pressure, urine, weight, fundal height, and your baby's heart rate if you're over 24 weeks. Blood pressure is always checked because hypertensive disease in pregnancy is a major complication worldwide and in Jamaica. And if your blood pressure is going up, we want to find it early so we can intervene. We also want to check if you have appropriate weight gain. We also check your fundal height, which is the size of the belly, so we can check if the baby is growing appropriately. We also check your urine for any abnormalities, as this may indicate if an infection is present or may cue us into a more serious illness, such as diabetes or high blood pressure. So to repeat, there are 5 things tested every time you come to clinic: blood pressure, urine, weight, fundal height, and if you're over 24 weeks, the baby's heart rate. At booking, it's routine for your blood count, blood group, HIV, and syphilis status to be done. These will be repeated in the 3rd trimester. If these tests are abnormal, there are treatments available to reduce the risk that the baby will be harmed, and we would want to start them as early as possible in the pregnancy. If you're found to have any abnormalities such as a low blood count or noted to be rhesus negative, blood tests may be repeated at different times. The only other test done routinely in the antenatal clinic is a screening test for diabetes in pregnancy. This is called the O'Sullivan's test, or OST, and it is done between 24 to 28 weeks. If this is abnormal, we will offer you an oral glucose tolerance test to determine if you have developed gestational diabetes in your pregnancy. So to repeat, there are 5 tests that are done routinely in your pregnancy: your blood count, blood group, HIV, syphilis, which are done twice, and your O'Sullivan's test, or OST, which is your test for diabetes in pregnancy. Most of what you do is important to us. Please inform your doctors if you take any medication or vitamin supplementation, as we want to ensure it's not potentially harmful to you or your baby. For the most part, your prenatal vitamins have all you need to take care of you for your pregnancy, even folic acid supplementation. If you need anything additional, your doctor will let you know so. However, there are some foods that are absolute no-nos in pregnancy. Please take note of what these are, and please do avoid them. Undercooked eggs, undercooked meat, alcohol, raw fish and sushi, excessive amounts of caffeine, unpasteurized dairy products, soft cheese, and foods with high amounts of vitamin A. While we encourage healthy eating, appropriate weight gain is very important in pregnancy, especially if you're overweight coming into the pregnancy. Normal average weight gain for a pregnancy is 25 pounds. We're here to answer all your questions and are open to speaking about topical health issues such as mosquito-borne illnesses and mosquito control. Smoking, even exposure to secondhand smoke, consuming alcohol and illicit drug use are absolute no-nos in pregnancy and is discouraged by us. We do, however, encourage you to exercise and create healthy habits that you will hopefully take with you for the rest of your life. Your 1st trimester ultrasound gives us the most accurate estimation of your due date and therefore is the most beneficial to us. We can also find out if you're having 1 or more babies in this pregnancy. Provided the antenatal period remains uneventful, the one ultrasound that is absolutely needed is an anomaly scan at 18 to 22 weeks. This is an exciting time for all of us as we check the structures and see growth and health of your baby. You get to see your baby in action, and for most persons, what they anticipate the most is the opportunity to find out the sex of their baby. It's important that you know once you're booked in this clinic, you can come and see a doctor any weekday between 8 and 4 p.m. if you have a concern. Anytime after that, you can go to the emergency department. But if you are after 24 weeks gestation, you may always go to the labor ward if you have any concern. A doctor will be there to see you 24 hours a day. There are some symptoms that every pregnant woman should know about, because if she experiences them, she should not take it lightly. She should come straight up to the labor ward, as early intervention can save her life or the life of her baby. You absolutely must present to the labor ward if you experience severe vaginal bleeding, fits, severe abdominal pain, if you're too weak to get out of bed, if you have fast or experience difficulty in breathing, if you have reduced fetal movements, as in you don't feel the baby moving as he or she used to, if you have fever, severe headache with blurred vision, or swelling to the fingers, face, and legs. By 28 weeks, ensure you have your bags packed and ready for labor and delivery. With you, carry the following items. Finally, when our babies are ready to make their debut and our mothers are in active labor, you come up to the labor ward. What's active labor? I'm happy you asked, because sometimes in the weeks leading up to delivery, women may experience uterine contractions or even pass blood or mucus from the vagina and come up to the labor ward thinking they're in labor. You come to the labor ward when you're feeling uterine contractions at least once every 10 minutes, or if your water breaks with or without pain. We'll be here ready and waiting to serve you. Our experienced midwives and doctors will navigate you through the labor process while monitoring mummies and babies closely. In the end, we do all in our power to ensure a safe labor and delivery for mummy and baby. As soon as the baby is born, we establish skin-to-skin contact and breastfeeding. After delivery, you and your baby will be transferred down to the postnatal ward, where our nurses and midwives would offer assistance and encouragement. They have classes on how to care for the baby and are also alerted to come if any of the complications that can occur at this stage arises. If you have any concerns, you can return to the postnatal ward up to 6 weeks post-delivery. This is before your postnatal visit, and you or the baby can be seen by a doctor. 6 weeks post-delivery, we complete our journey with a final postnatal visit. We check our mummies and babies thoroughly, with keen attention to family planning, mental health, and social support. Thank you for entrusting us with this very special time in your life. In this department, we always aim for healthy mummies and healthy babies. At this institution, we deliver the very best health care. We welcome your feedback, and it was our pleasure serving you.